Good evening. Belated happy Thanksgiving. For week one, physical agent lab, I'm going to be talking about, or I'm going to give a little bit of overview about paresthesia, analgesia, and anesthesia. So the first one, the paresthesia is it's like a numbness sensation. Like for example, when you slept in a funny position, then when you wake up in the next morning and you feel that that one side of your arm like numbness or like a tingling sensation, that's like a sample of a paresthesia. But it depends on the primary origin of the cause of it, in the extent level. Just a little bit of overview what is paresthesia is. The second one is the anesthesia. So it's a loss of sensation. Typically, um, this one they use it for like when you go under surgery. So what it does do, it relaxes you, it blocks the pain, it makes you feel like sleepy or forgetful, or basically just make you feel unconscious throughout the surgery. So if I remember in pharmacy, in my school when I went to pharmacy technician, one of the most common drug that people use, like they call anesthetic medications. It's the Diprivan or the Diprivan. This is the trade name, or the what we call the Propolol, like Propolol. So the other one is expensive, the other one is cheaper, but basically they have the same effect of it. So that's what it does do. It keeps you like sleepy or unconscious towards the surgery. So when you wake up after the surgery, you don't remember anything because the drug does control your blood flow, blood pressure, your breathing. So when you undergo with that medication, basically you don't know or you don't remember anything. The last one is the analgesia. I love this topic because as far as I know, there's two kinds of analgesic, common types of this, which is the analgesic. So the example is the like acetaminophen, like over the counter. So what it does do, those medication is just relieve the pain. But like Tylenol, acetaminophen, they have no anti-inflammatory properties. So when you look on the other side of the analgesic medication, you will encounter the um, anti-inflammatory medications, or what they call the NSAID drugs, so non-steroidal anti-inflammatory drugs. One of the example of this is the ibuprofen. So it does, aside that it does relieve pain, it also helps you to reduce the swelling or inflammation. So there's two kinds of that. So if you buy it like over the counter in supermarket or in pharmacy, you should know which one you better use. Just for pain, acetaminophen, Tylenol, or pain with inflammation, ibuprofen or Motrin. So that's a little bit of overview what we talk about for week one. Thank you for watching and have a good night.